If you're approaching Medicare eligibility and you are still working and have group coverage, here are two really important things I want you to remember. First, for those of you who are working at a company with 20 or more employees and you decide you're going to stay on that plan, still consider signing up for Medicare Part A as long as you're not contributing to a health savings account. So why do I say this? Well, first of all, if you have worked for 10 years, you have 40 credits, A does not cost you anything. It's a $0 monthly premium. And by enrolling in A, it means that you are going to have a Medicare number, you're already in the system. So when it's time to retire, or let's say you lose your job, the process of signing up for Medicare is that much easier. Second, for those of you who work at a company with 19 or less employees and you have group coverage, not only should you sign up for Medicare Part A, but you also need to sign up for Medicare Part B. Let me explain. When you work at that company with 19 or less employees, your insurance is then secondary to Medicare, which means if you don't sign up for Medicare, you do not have a primary payer. Now, that could never end up being a problem, but it also could be a huge problem. If you got really sick and you had big medical bills, your insurance plan may realize, hey, we're not responsible for this bill because we are secondary to Medicare. So unless your employer is going to put in writing that plan is going to remain primary for you and guarantee that, you're going to want to take Medicare Part B. You could consider keeping that group plan as the secondary payer to Medicare, but that also may be a very expensive proposition.